are entering a new world of health care. It draws upon the same science and uses the same instruments and equipment that health services traditionally do, but yet in its philosophy and its practice, it is different in some startling and significant ways.
In the beginning, as we like to say, back in the 1960s, there was a demonstration project designed at the federal level to do something related to a very community-based health program.
The idea was to deliver high-quality, accessible, comprehensive, one-door care where the whole family's health needs could be met. They called it the Neighborhood Health Center.
It was modeled after programs that had been successful through the Peace Corps in Africa, in which the local community, through a board of directors or an advisory committee, designed a health center to meet the needs of that local community. And there are two that claim to be the first in America. One of them was funded first and one of them was open first, so you take your pick who was first. In Mississippi, in Mount Bayou, Mississippi, there was the first rural health center. It was founded by an individual that had been a part of the African model, looked at it and said this will fit in rural America. And if you looked at rural America in the 1960s, we had massive healthcare needs.
I've never seen any use in what I call the Schweitzer bit, which is the idea that you stand around in whatever circumstances, laying hands on people in the traditional medical way, waiting until they're sick, curing them, and then sending them back unchanged and into an environment that overwhelmingly determines that they're going to get sick. We think there's a better way to do it by using health services as a route of entry for these other kinds of social change.
The second one is in East Boston, Massachusetts, which was an urban healthcare center. Another very distinct and different type of healthcare environment, but nonetheless one that has great healthcare needs. Those two organizations were founded in the 1960s. From that model, the demonstration project was expanded. In the 1970s, it actually became a line item in the federal budget. And by 1980, there was other auxiliary things that went along with it, like the National Health Service Corps and some other things. By the 1990s, health centers established a relationship with the Centers for Medicaid Services, in which they got enhanced reimbursement. By the late 1990s, we also got Federal Tort Claims Act protection, which is the liability insurance for all our providers. And so this program grows over the course of time to by the early 2000s. Then we had the massive expansion of the number of health centers. The original Community Health Center in Virginia is in Buckingham County. It has a history that's unbelievable. If you go back to the original founding lady, Miss Wiley, made the decision that it's not acceptable to have to haul people to UVA to see a doctor.
In basically the Buckingham, Fluvanna, Cumberland community. There was no easy way to get to Richmond or to get to Charlottesville to UVA, and so she said, we need to have doctors here in town.
I remember I attended the second meeting concerning the establishment of this health center. I was invited to a meeting by Ms. Wiley. I didn't know what she was talking about, a health center. But anyway, she had been carrying people, sick people back and forth to the University of Virginia. And she thought there should be some kind of a facility here. And she knew about health centers because she worked for what was then called a CPAC. I want you to know that this place did not happen out of a vacuum. No one woke up one morning and said, let's put a health center in Buckingham. So much of it was the work due to this lady here. She made the first move.
She encountered mass resistance from people in the community because the perception was this was a federal program that'll be funded for a couple of years and then the county will have to pick up the tab. The things that she had to do to found that organization, have meetings in secret, form local advisory groups to get things done.
She was an African-American woman and met with a lot of opposition in the county to get us started, but she was successful. Thanksgiving in 1970, we opened the doors here. Oh, not particularly here, but we opened as an organization in several trailers up the street from where we are now. And I think that she could never have imagined that we would have grown to what we do now. She had such foresight to see that this was something that was desperately needed in the community.
The second one we attribute to the Eastern Shore.
When this idea of a 330 grant or some sort of grant would be given to communities that would go without, either because of insurance issues or not enough doctors, they went up to Philadelphia. When that was with the Region 3 office, they went in and spoke to folks and were turned down. They said, we don't see how we can fund this program. They went out literally in the hallway and picture an old Philadelphia building with wooden benches in the hallway, and they sat down and they decided they needed to go tell the story even more colorfully and more clearly. And they did just that. That's how we got the first grant of $100,000 to get started in Eastern Shore Rural Health in 1976.
Stories like that, the history of what we've done. In the 1970s, there were a lot of health centers started in Virginia. Some survived, some did not. Some merged with other organizations. So by the time in 1980, when the Primary Care Association was actually founded, there were 13 health centers in Virginia.
Stone Mountain had 2 sites. Pat Hughes was the director at that point. Clinch River had 1 site. Tom Strickland, which was actually a nurse practitioner there, served as their executive director. Bland County had 1 site. Jan Ramsey was the director there. Tri-Area had the 1 site. Barney Day was director here. Eastern Shore had 1 site. Carol Reineth was director there. Dawn, which is just outside of Richmond. Frida McNeil was the director there. Boydton, Dave Burkett was the director there. Central Virginia, the guy's name was either Marshall Loudon or Loudon Marshall, but they had 2 sites. Pitch, which Edwina Davis Gary now, was a director there. King William, Carolyn Cook was a director. Central Piedmont Health Services, Joe Brogan was director there. Ivor, Doug Ward was the director there, and I was the director for Salville Medical Center.
We use the terminology community health centers because if you are a funded agency by the federal government through the Bureau of Primary Health Care to do community health work, you're funded as a community health center. There are certain categories of that. You can be a primary care site, you can be a community health migrant site, you can be a healthcare for the homeless site, you can be a school-based site. Each one of those has a different sub-funding, but they're all community health centers in some form or another. The first premise, obviously, of the patient base is that they serve the medically underserved. We provide care regardless of the patient's ability to pay. So if you have insurance, great. If you don't have insurance and you qualify, we'll put you on a sliding fee scale. And if you can't afford the nominal fee, then we'll waive that as well. No one is denied access to care. The second thing is it's culturally and linguistically appropriate. So we look at the community, make sure that the providers match the needs of the community so that the healthcare center in a community fits the community itself.
From the outset, the health center idea was based on the concept of community participation, that residents in the center's neighborhood cared about the kind of service they would have, and that they must have an influential voice in determining the way in which care was delivered.
One of the unique things about a health center that we haven't talked about is the fact that a health center is a community organization. They must have a community board of directors. That board of directors is made up of 51% consumers of the service.
People ask often, well, you have a board with individuals that you provide services to on your board. Doesn't that impact your ability to go out and fundraise? Because you think of a board of being a corporate level. You know, they open doors to a network you wouldn't think consumers would get the door open to. But you know what? They keep our board so grounded. When they hear individuals who are getting services talk about things that we've all experienced. You know, I had to wait 20 minutes before they brought me back to the examining room. We need to look at how can we change that.
I think it's challenging when you put a mixture of all walks of life in a room and you try to come out of that feeling like everyone had a voice, because their voice comes from many, many different histories, cultures, backgrounds. You know, the best thing about a community health center is its board, and it's perhaps the most challenging thing. But at the end of the day, all of them believe in the mission. At the end of the day, there's no competition. At the end of the day, it's all about the patient.
If you are a clinician who wants to take care, truly wants to take care of people, all kinds of people, this is where to be.
We actually see the patient as the whole patient who needs services. So we rather spend the time getting to know the patient, getting to know the patient's family, so we can figure out what services they need.
A community health center is a place where people of all races and income levels can come together, a place where different people can come together, sit in a waiting room together, get services, feel good about this as a community institution.
A very cliched statement is, you've seen one health center, you've seen one health center. And people say that about a lot of things, but it could never be more true, because every community is different. If I'm in a small rural community, then that culture, that environment is very different than if I'm in an urban setting. If I'm with a health center that's been in existence for 30 to 40 years versus a health center that just started yesterday. If I'm working with a new executive who came into the process kind of like I did 17 years ago, really not knowing what a health center is, or if I'm working with someone who's been in position for a long period of time. If I'm working with a board of directors that is very representative of their community, or one that's really newly recruited and need training. So what I enjoy doing more than anything else is getting out into the community, meeting the boards and the staff, and understanding what that health center is, what it has been, what it can be, and where it wants to go, and then figure out where we fit in as an organization to make that happen. I enjoy very much understanding that and trying to help people understand where they fit into the bigger model.